Hello everyone, my name is Yunisleidy Rodriguez and I'm going to be presenting about the causes and treatments of esophagitis in children. Sample and population. Study describes the known causes and treatment options for the manifestation of esophagitis in children. Variables. Dependent. Children who had the symptoms of this esophagitis. Independent. The presence of esophagitis. Hypothesis. No, there is no relationship between familiar experiences and the manifestation of a gastroesophageal reflux disease or esophagitis in children. Alternative. There is a relationship between familiar predisposition to gastroesophageal reflux disease and the manifestation of gastroesophageal reflux disease in children. Levels of measurement. Nominal. Children with symptoms of esophagitis. Ratio. Total patients with familiar predisposition to the condition. Standard rates of esophagitis diagnosis in the United States among children. Sampling procedure. Used to select sample and all others information. Familiar predisposition to the condition is a stronger factor. Data analysis. Purpose: to access the causes and possible treatments for children with symptoms of esophagitis. Analysis: the treatment and the condition is best managed by dietary changes to mitigate symptoms. Findings: decrease in symptoms of esophagitis when dietary changes were enacted. 40% chance to children to avoid the illness if not fed to food that cause distress to their symptomatic parents. All participants provided with privacy standards of protection. Apply U.S. Law Insurance Portability and Accountability Act to protect personal information, medical records, and other sensitive information. Prospective budget: 100 participants, $10,000. Statistics assistant, $1,000. Materials and questionnaires, $1,500. Total, $12,500. Metacognitive awareness was evident to parents. Study performed in 2016 in San Francisco, United States. Collaborative to determine dietary changes required to minimize symptoms in children. Comparison of familiar predisposition provided insight into 5 years. Ethical research principles were followed leading to satisfactory results. Research question: are children between the ages 3 and 10 who have parents with gastroesophageal reflux disease at increased risk to develop gastroesophageal reflux disease themselves, compared with children between ages 3 and 10 whose parents do not suffer from gastroesophageal reflux disease? Information: many children suffer from gastroesophageal reflux disease. The disease has severe and painful symptoms. Analysis of the causes and treatments of this esophagitis provides strategies to minimize childhood discomfort. No, there is no relationship between familiar experiences and the manifestation of gastroesophageal reflux disease in children. Alternative: there is a relationship between familiar predisposition to gastroesophageal reflux disease and the manifestation of gastroesophageal reflux disease in children. Results of the test: existence of commonality in the development of gastroesophageal reflux disease in children whose family members also had the condition. Conclusion: the treatment of esophagitis is still restricted to dietary changes. The causation of this condition is strongly linked to familial predispositions. Future research: genetic or other testings to determine proclivity of children to develop this condition. And these are all the references that I use. Thank you and have an excellent day.